welcome to another episode of Before and Beyond, where we discuss interesting cases that we see in the clinic and how we would manage them. So as a general dentist, I have an interest in all areas of dentistry, but I guess my greatest strength as a general practitioner is that I know enough about every area of dentistry to be able to combine them for achieving the outcomes for my patients. So let's look at this interesting case together. So this is a young patient who appeared like this. This case is a referral actually from a colleague of mine. The patient actually came in because he broke a filling on one of his front teeth. Obviously in this photo the filling has already been repaired, but there were concerns about several things. Number one, of course, like how we can prevent the filling from breaking again, because he reported that the filling had been done quite recently, like less than 6 months, and it already fractured. And he's also been through a series of aligner treatments at another clinic. And this is the way his treatment actually finished. So there's still quite a lot of irregularities in the positions of the teeth. You can see that on the lower front teeth. And also the bite is really not ideal. So we can see that the back teeth are still not aligned properly. He actually had some of the back teeth extracted, which I will show you in the next slide. But the main issue is that his front teeth are overlapping almost completely. So when he bites down, so this is how he bites down normally, you can't really see any of his lower front teeth. So that's the reason why the lower front teeth are really quite chipped and worn down. So all of these front teeth, they've lost about 20 to 30% of the tooth structure because they keep like hitting on the back of the upper front teeth very heavily. And that kind of very heavy pressure on the front teeth is probably also what caused the previous filling to be lost prematurely. So as part of the aligner treatment, there were 4 teeth extracted at the places indicated by the arrows. When we do extractions with aligners or like braces, at the end of it, we do actually want to get the roots of the teeth aligned. So I've drawn in the outlines of the existing tooth positions, and you can see that the roots are diverging. That means they are not parallel with each other. So that indicates that, you know, there was poor control of the tooth movement in the previous aligner treatment. So one of our goals is to actually get the roots to be parallel. So we want to see all the roots just nice, vertical and upright at the end of the treatment. So the reason for that is not just to get a nice looking x-ray, although that always is a bonus. If the teeth are not in the correct axial position, that means the angulation of the teeth is not upright, that will not create a very nice looking bite. So if we look at the bite from the side, if we look at this area, you can see that the teeth don't really fit together ideally as they should. And that's because the angulations of the teeth have not been fully corrected. So if the angulation of the teeth is not corrected, then the patient's not going to bite evenly on the entire tooth. They will probably bite on certain areas like the back of the tooth more than the front. And that will mean that that back area of the tooth is going to wear out a lot faster because there's just less surface area that the patient is biting on. You can think of it as the difference between, you know, wearing a high-heeled stiletto versus wearing flat shoes. The high-heeled stiletto is going to show a lot more wear on the tip of the heel because there's just a much smaller surface area that's being used compared to the flat shoe that's going to get some wear, but it's going to be more evenly distributed along the entire sole of the shoe. So that's the reason why having this kind of angulation is not ideal, because you just get a lot of uneven pressure and subsequently uneven wear on those parts of the teeth which are in contact. The other issue that we had as well was that the proportions of the teeth are not quite ideal. So if we look at the upper front teeth, so the patient has already broken one of the fillings on the upper front teeth. So at the end of it, we need to improve the conditions in the mouth so that this doesn't keep happening. So after we have figured out how the upper front teeth should look, we came to the decision that basically these two upper central incisors, so the teeth right in the center, they basically are too short and too wide. So it just makes the tooth look very fat. So in order to improve that, we actually have to open a little gap in between the two front teeth. And the patient said he actually had a gap there before, but previous dentists have tried to, close the gap, but that actually makes the tooth look wider. So this is how we would correct the proportion. So not only did we open a gap between the two upper front teeth, we also added some material to the edges of the upper front teeth and even the canine, which is worn down, and that already makes the tooth look much more proportional. Okay, so it doesn't look so short and fat anymore. It looks like a more slender tooth, so that will make the smile look even nicer. And the other issue which he has is, when he smiles, or even just looking at the proportions of the teeth further, the gum level is not really in the right position, and it's not the right outline as well. So we are planning to actually move his teeth because, again, he has some issues with the positions of the teeth. And instead of trying to close this gap by making each tooth wider, we're actually going to move the two teeth closer together, and that movement is actually going to close that space that he has in between the two upper front teeth. I've also included this additional procedure. If we look at this outline of red, he has quite a fleshy, what we call frenum. So a frenum is just a vestigial muscle attachment. So it doesn't really do anything functional. It just attaches the inside of the upper lip to the underlying bone. But in a case like this where the frenum is very close to where the teeth are, that can actually keep this gap open. So we will have to reposition this when we actually do the removal of the excess gum tissue here later. So he's just at the beginning of his journey. So he's actually starting with some orthodontic treatment. So you can see the braces on the back teeth. And we are also going to deal with the wear and the position of the lower front teeth, which are sticking up way too much. So you can look at this kind of summary of what's going to happen. So the upper front teeth, are in the current position in the white background, but they are tilted, backwards, and they are sitting way too low. So those upper front teeth need to move up and, tilt to the back. And you can see the lower front teeth are again tilted to the back as well, and they are situated way too high. So this is all going to happen with movement of the teeth. And that will not only give us the opportunity to correct, as I said, the angulation of the back teeth, which were not properly corrected with the aligner treatment, but also to improve the bite on the front teeth, which is responsible for how long those fillings on the front teeth will last, and also responsible for the quite severe chipping, of the lower front teeth. So stay tuned as to how this case is going to work out. But this is really what I enjoy doing the most as a GP, which is combining different kinds of treatments together so that we can identify and manage the problems that a patient has, but in a holistic way. So that is, I think, the greatest strength that GPs have, because we can see the big picture and we can coordinate different treatments to give a holistic result, which will give something long-lasting and healthy for the patient. So I hope to see you on another episode of Before and Beyond, where we can share more cases like this. And if you've been following our series so far, please drop us a like or a comment maybe about, what other interesting cases you would like to see, and maybe we can cover that in a future episode of Before and Beyond.